Well, I would say families can help by practicing good hand hygiene when visiting, but also staying up to date on their vaccinations, like their flu shots, their COVID-19 vaccination, avoiding visiting when they're sick. They're seeing this, they need to be the advocate because their loved one can't always speak for themselves.
Hey out there, welcome back to the Nursing Home Abuse Podcast. My name is Rob. I'll be your host for this episode, talking about infection prevention in nursing homes from a generalized standpoint. We're going to be talking about universal precautions, making sure to wash your hands, and making sure that you take your Lee press-on nails off before you go into your work on the shift. But we're not doing that alone. We have the fantastic Bonnie McCormick with us to help us through this process. All right, but before we get into that, it's time for the nursing home regulation question of the week. And once again, your opportunity to win a fantastic Nursing Home Abuse Podcast coffee mug. It is fine china for you to sip your morning coffee from. How do you win, you might ask? Well, it's you have to go through an octagonal maze. First, go to our TikTok, which is @JusticeForResidents. Then you're going to search for a specific thumbnail. That thumbnail is going to have a calendar on it with the word Friday. So search for the calendar. It's got Friday written on it on our TikTok. Click on it, comment the answer to this week's question of the week, as well as your favorite day of the week. So put your favorite day of the week and the answer to the question, and that enters you for a chance to win. My favorite day of the week is Friday because that is when I record all of these podcast episodes for you. It's grueling sometimes, especially when there's about 7, 8, 9, 10 episodes in a row that I have to do, but I do it for you. This is my work for you. Anyway, we will pick one random winner and announce on Sunday on TikTok and our website, which is shinkfirm.com/podcast/giveaway. Again, it couldn't get any more difficult, but the prize ships at the end of the month. All right. This week, I think the question is probably medium difficulty. So if you get this right, you get an extra scoop of raisins in your Raisin Bran this week. Under 42 CFR 483.25E, the nursing home must ensure that a resident who is continent of bladder on admission receives services to maintain continence unless A, the resident's clinical condition makes it impossible to maintain continence, B, the resident is non-compliant with continence care, or C, the facility delegates continence care to someone else. And that answer is A. The facility is required to ensure that a resident remains continent of bladder unless that resident's medical or clinical condition is such that that is impossible. All right, now it's time to get into the meat and potatoes of the episode. As I mentioned at the top of the show, we are not having this conversation alone. We are pleased to have on Bonnie McCormick to talk about infections generally in nursing homes. Bonnie McCormick is a seasoned nurse with nearly 32 years of experience, bringing a strong clinical background in both hospital and long-term care settings. She also has extensive expertise in the managed care industry. Since 2018, Bonnie has worked as a legal nurse consultant and as a certified life care planner. A dedicated patient advocate throughout her career, she remains committed to improving healthcare outcomes. Bonnie resides in Jacksonville, Florida, with her husband and 4 sons, and we are so happy to have her on the show today. Bonnie, welcome to the show.
Thank you.
So it's not uncommon that I get calls from potential clients and their loved one is in ICU with sepsis or septic shock. And that's almost always, as far as I know, there is an underlying infection. Okay. So in your experience, what are some of the more common types of infections that you see in nursing homes that will cause a person to end up in the ICU with that sepsis or septic shock?
I would say that there's kind of a top 3 or 4. The most common infections would be urinary tract infections. soft tissue infections, gastrointestinal infections like C. diff or, one of these, or even respiratory infections. Those I think would probably be the most common that we see.
Okay, so walk me through then from walk me through the types of prevention methods that a nursing home staff member can take to prevent the UTI, to prevent the C. diff, to prevent the gastrointestinal infections. Like, what are they doing on their end?
Ideally and theoretically, staff can prevent infections by following strict infection control protocols like proper hand hygiene, using personal protective equipment, PPE when necessary, regularly disinfecting the surfaces and the medical equipment, ensuring proper catheter, wound care, sometimes having to isolate the residents with contagious, illnesses. Most nursing homes do have vaccination programs for their residents and their staff, and that can help. But, whenever you have a lot of people who are somewhat elderly and immunocompromised, infection is always going to play a role in their quality of life.
So, typically, how, like, you mentioned infection control protocol. What typically is involved in a typical policy for infection control? Like, I understand, like, using PPE and stuff like that, but like, is it PPE as soon as you walk in the building? Is it PPE only when you're interacting with people? Can you kind of explain, walk me through the typical protocol?
Well, PPE should be used anytime you're going to be coming in contact with anybody's bodily fluids. So, if someone is going to be changing an adult brief, changing out catheter, emptying the catheter bag, helping someone use the restroom, giving, oral hygiene, any of those times that you're going to be interacting with someone's bodily fluids, you absolutely have to wear gloves and wash your hands after you take them off and use a alcohol-based sanitizer, hand sanitizer. That is proper, basically what we call universal precautions. When you have someone who has something like C. diff, which is very contagious and is usually hospital acquired illness, you have to take into account that they probably need to be isolated so that that doesn't spread. And as far as the respiratory infections, we went through this whole thing with COVID-19. Remember, who doesn't remember that?
Right.
That has to be taken into account as well when you have respiratory infections, that there should be some kind of mask used. And sometimes, depending on the infection, you may have to use full body, the yellow gowns that are not hazmat suits, but there are yellow gowns that you can wear that cover up your scrubs if you're going into a room that has, another type like RSV or any of those type of illnesses that can be passed back and forth between the residents. So the CDC and CMS both have really good guidelines on infection control, and nursing homes should be following them to a T.
You mentioned that C. diff might require that a resident be isolated. Sometimes, what are some other infections that might require that you quarantine a resident?
Well, obviously tuberculosis, that's a big one. And, COVID as well. Those are probably the big ones. Sometimes we see a whole rush on tuberculosis. In this country, it's not as bad as in other countries, but tuberculosis has always been a pandemic, and it's been an epidemic all over the world. So if it's something really contagious like that, then obviously they probably shouldn't be in a nursing home, and they probably should go
Sure.
to a tertiary care facility.
So tell me then about, okay, so you have a resident that has C. diff or COVID-19 or some type of infectious respiratory disease. When we say they need to be isolated, what typically does that mean? Like, is it just like all right, roommate, you got to get out? Or does it mean like in the movie, what is it, the movie Outbreak? They're like duct taping plastic and stuff. Kind of walk me through that process.
Well, in a typical COVID-19 environment, no, there's not like outbreak where you have, the people in the moon suits and all
Right.
like that. It's not quite like that. But, theoretically, the CDC has said, a 6-foot distance for COVID-19. And if you have a roommate, then sometimes you can keep that distance, and but it's not ideal to have two people who are, someone who's infectious in a room with someone who's not infectious, but it can be done if you are really, really strict with, your proper hand hygiene, your PPE and separation. It's not always possible to do that in close quarters. So if someone needs to be isolated, ideally they would have their own room.
So you mentioned universal precautions. What are some myths about universal precautions that maybe that you found? Like, so for example, like, you got to sing the birthday song twice, washing your hands. Like, are there any like the public should know about?
Well, it's interesting. I've taught universal precautions in nursing homes for years and years as a consultant for the state of Colorado. And I would go into these places and people would think just because they ran their hands underwater, and wiped them off on their jeans, their scrubs, that was hand washing. And it's really not. You really do need to use soap with warm water and scrub your hands so that you're actually scrubbing the germs off of your hands and into the sink. It's literally a mechanical motion of taking those germs and running it under the water using soaps as an exfoliant, basically, to get the germs off of your hands and into the sink. And then when you're done with that, drying off with a clean towel and using that towel to open the door if you're in a bathroom, because a lot of people don't wash their hands and then you're just contaminating yourself again when you leave the bathroom. So, and the other thing that's some of the myths are that about hand washing that you just, it's not important, or you just have to run your hands under the water. And I always recommend, even if you wash your hands and dry them and do the towel on the doorknob and all that, to use an alcohol-based hand sanitizer after, because at least that way you're getting two different ways of killing germs. You're getting the germs off of your hands by washing them in the sink, and then you're using an alcohol-based sanitizer to actually kill any other germs that may still remain on your hands.
I was recently reading a survey from Georgia of a nursing home, and it's got to be really bad when the surveyor like really gets in depth on certain things, like because at least in Georgia the surveys are not really like super specific on things. It's like very general. But this particular survey was like, nurse A had press-on nails, fake nails that were 3 inches long, and they were cited for the hygiene statute. I don't know that was they must have really made the surveyor mad, because like I feel like that's something that wouldn't go in a typical survey. But anyway, I guess universal precautions and nursing would say don't have extremely long fake fingernails.
Well, the protocol I have an ICU background, hospital ICU background, and none of those nail products are allowed in a hospital environment. You're not allowed to have gel nails, acrylic nails, press-on nails, none of that. You can only have natural nails. And if you, want, you can have a layer of clear nail polish on there just for strength purposes. But those type of additives to your hands are just little germ catchers. And also another thing is excessive jewelry. If people have on a ton of rings and bracelets and this and that, bacteria can get hung up in the jewelry. And if you don't scrub those really, really well, then you're not really getting your hands clean.
What would you say, like if you have a family that has a loved one in a nursing home and they're concerned, what advice would you offer them in terms of like, hey, here's how you can prevent infections in your loved one?
Well, I would say families can help by practicing good hand hygiene when visiting. I'm in the Florence Nightingale School of Nursing, where good hand hygiene is paramount. But also staying up to date on their vaccinations, like their flu shots, their COVID-19 vaccination, avoiding visiting when they're sick, or if they, want to wear a mask if their loved one is particularly susceptible to respiratory infections. You can always wear a mask, but just really encourage proper hygiene. And they should also advocate for their family members, to ensure that the facility follows infection control procedures. And if they have a caregiver with 3-inch nails and who's not wearing gloves, I mean, how can you wear gloves with 3-inch nails? If they're seeing this, they need to be the advocate, because their loved one can't always speak for themselves.
So we talked about prevention. We talked about, these are the things that we can do to prevent the infections. Let's talk about the signs and symptoms of infection. So typically, what kind of causes alarm bells to go off in your head as a nurse and a resident where you suspect an infection of some kind?
Well, I mean, as a nurse, I always look at vital signs first. Do they have a fever? Because that's a big sign of infection. But not everybody is going to run a fever when they have an infection, especially an elderly person whose immune system is not working the way that a younger person's immune system is working. So, of course, I'm going to look at their vital signs and see if something is off. But as a family member, if it's someone, your loved one, you're going in there and you notice that they're just acting different, like maybe their mental status is off, and that's not their baseline, just something off of their baseline. You can kind of get a gut feeling for something is going on. A big red flag for me for UTI is a change in cognition. So when elderly people get urinary tract infections, and they do a lot, one of the first signs is actually they have a changed mental status. And so anytime somebody's mental status changes, you have to really kind of dig in and see what is going on with that person and look at the bigger picture, because there's, it may not be something, but it, like I said, there's a lot of stuff that goes on in nursing homes and a lot of infection that floats around. And so you don't want to let those signs and symptoms go by the wayside.
I think that's so interesting that, one of the first telltale signs of UTI is that behavioral change. It's the person is seeing their ex-spouse from 50 years ago out the window kind of thing, as opposed to, say, foul-colored smelling urine or cloudy urine, or with pneumonia, like there's they're not coughing up a lung or something. It's the cognition and the behavior change that should start to signal, hey, let's look and see what type of infection that could be.
And that's because their bodies are not responding the way they used to. As people age and as they decline in their health, their bodies do not respond as quickly. They don't run the fever as quickly. Their lungs aren't strong enough to start coughing up the gunk that's kind of collecting in their lungs. They may be weak. And so that's why sometimes that's probably happening. The urine is probably getting cloudy and they're probably getting some blood in the urine. But until someone's actually looking at it, one of the best ways to know if you're just sitting in the room is just talk to the person and see if they're changed. That's one of the best ways.
Well, Bonnie, thank you so much for coming on the show and sharing your knowledge with us.
Thank you for having me. I enjoyed it very much.
Folks, I hope that you enjoyed this episode. I hope that you found it educational. If you have any ideas for topics that you would like for me to talk about, please let me know. If you have any ideas for guests that you would like for me to talk to, please let me know that as well. Also, please be sure to try and win the coffee mug, or just tell me that you want a coffee mug. I think at this point, I'm not sure if anybody has won a coffee mug yet, and there are several boxes of coffee mugs at my house that are taking up room, and my wife is going to get mad at me. So be sure to enter the contest to win the coffee mugs. If you enter, I promise you, it's highly likely that you will win. New episodes of the podcast come out every Monday. And with that, folks, we'll see you next time. Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said on this podcast, either by the host or the guest, should be construed as legal or medical advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes for now are available every other Monday on Spotify, Apple Podcasts, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.